Yesterday's surgery went longer than expected, but she's been doing pretty good making noises when she feels bad. She is feeling good enough. You like Hallmark movies?
There's a new day that will come again tomorrow. There's a new day to wash away the pain.
Yesterday's surgery went longer than expected, and her blood pressure's high, which I don't think it's like crazy high. I don't think they're worried about it, but it's not normal. Normally after surgeries her blood pressure's low, so they're monitoring her blood pressure really closely. And yeah, being in the pediatric ICU, I'm glad she is, just because it means there's one nurse for every 1 to 2 patients, and they can be a lot more on top of getting her meds as soon as she needs them. Or like at one point she couldn't have any more meds, but it was close to med time, and I was like, can she have a warm blanket? And it was just like instant, yeah, here's a warm blanket, which really calmed her down and helped us get through the next 40 minutes till she could get some meds. Wasn't the same as meds, but it worked good enough. So we're glad we're in the ICU. I don't think she'll stay in here a lot longer. I don't know. She's also got these weird, it's called an ESP if you want to Google it. It's when you can't get an epidural. This is an alternative. It's kind of like an epidural, but not as effective. But I think it's helping. So she's got these little tubes going into her back on either side of her spine. They might keep her in the ICU until she's allowed to have those tubes out. I don't know. It's a good place to be though. If you're feeling bad, if you're in pain, ICU, I think like they're gonna help with pain a lot, because there's no, let me take care of this kid first, I'll get to you, we're coming. Like, she's almost got her own dedicated nurse, so that's good. It is 4:30. RAELYNN'S been awake, I think, for about an hour and a half. I think a little after 3 she woke up. And I think just her bedtime meds, which are helpful for pain too, probably like Klonopin, had started to wear off. And the PRN dose of Valium was starting to wear off. So she's been awake and just a little uncomfortable. But they just got her some extra PRN pain meds. And she's awake. Like, she's like, I've got enough rest, but I don't feel great. But she is feeling good enough to take peeks at a movie, which I think is a sign she feels pretty good. So I'm going to show you her movie setup. Are you watching Lady and the Tramp? We've not seen that movie before. You can watch it just like this. Wow. So we have it set up where it is right in front of her. Look at that. It's kind of like a Hallmark movie. You like Hallmark movies? You're not sure you feel good enough to watch it? Your heart rate says you're feeling better. Your heart rate's gone down a lot. So, since she's not good always at telling us how she feels, we go by her heart rate sometimes, you know, to see is she sleeping, or is she pretending to sleep because she's hurting. But she's been doing pretty good making noises when she feels bad. So I think she's just listening to the story and feeling pretty good. She's not sleeping. Yeah, you're not sleeping. I'm telling him you're not sleeping. I could tell you're not. Mommy's gonna leave you be to watch your movie. We're in the ICU, or the PicU, pediatric ICU, which I think is probably where we need to be until her blood pressure gets under control. It's like right here is the matchbox, like right there.
You got it.
I say matchbox, I mean, it's obviously not. That's what I picture under her skin, though. It's not a matchbox.
There's a new day to take away your sorrow, and the old ways get washed out by the rain. to keep holding on through the night, 'cause I promise you this.
You feel a lot. Yep, that's fine. You feel a lot better. You feel a lot better.
There's a new day